if anyone has any questions about any of that, we can talk about it at the end. I don't want to take away from our first speaker for the evening. So I'm really excited that we have Dr. Robert Hyde with us tonight, who is emergency physician at the Mayo Clinic in Rochester. So you can put thank you. Make sure that you're on mute, everybody. But Dr. Hyde, in his spare time last year, thought that it would be a really great thing to become a tennis official. And so I had the pleasure of training him. And I'm sure he's going to tell you the story of the first day that he was shadowing me and how a parent came after me at a USTA tournament. And as we started talking, he told me that he teaches classes in de-escalation techniques. And as we were talking about different things, I saw the correlation between what he uses in the ER at the Mayo Clinic and what happens when we are all on court. And I thought he would be a great person to talk to the group, just to talk about a few different things. I learned so much when we just went over it, and I wanted to share his knowledge with all of us. So without further ado, please welcome Dr. Hyde.
Well, thanks, Lisa. It's really fun to have this opportunity to speak to all of you. And wow, there's 142. It looks like on my list. I can't see everybody, but hopefully someday I'll maybe have a chance to share some space on the court with all of you as well. Let me share my screen here before I go too much farther. And Lisa, is that showing up there for you guys?
Yes, it is.
Okay,
thank you.
Fantastic. Okay. Yeah, so Lisa told the story. I think it was my very first day shadowing, and a parent did in fact kind of come up, and we were up in the office, we were off the court, but myself and another person who was shadowing were there with Lisa. And this gentleman just kind of let her have it. And I think it caught us all a little bit off guard. It certainly caught me off guard. I didn't know what was happening. And this is not what I thought I signed up for at all. I really thought I was just going to be having fun being an official on the court. And then I guess I had my wake-up call right then and there. But Lisa was spectacular, and I was watching it happen, and I was like, she just, by the end of the day, she and this parent were best friends. And but it didn't start off that way. It started off, one very angry man, kind of right up in her face. And so a lot of the things that she did, we'll talk about tonight. And I suspect that many of you may already be using a lot of these techniques, either consciously or unconsciously. Mm-hmm. But I guess it's kind of my hope to share with you an approach to de-escalation. And some of it may be useful, some of it may not be useful. Actually, I'd love to get your feedback if you're willing to give it to me when it's over, for what you think could be helpful, or what's just not relevant for the court. But the other thing I'll just mention before I get started is that if you think a little bit about these de-escalation techniques, although we're thinking about our roles as officials on the court or near the court, really you can use them in any conflict situation. And I find myself using them with my 5-year-old, sometimes with my wife, with friends, whatever situation comes up. They're pretty universal, and they tend to be fairly effective. So let's kind of jump in. Picture yourself for a moment on vacation. You're out in the woods, and you're going for a nice walk, and you're having a great morning. And as you're going along, the forest gets more and more dense, and now it's a little bit hard to see, more than maybe 50 or 100 feet in front of you on the trail. And you turn the corner, and right there is this guy, and he's making these awful noises, and he's drooling, and he looks angry. And my guess is that within 1 or 2 seconds, you're probably turned around and running as fast as you can. Your part of your brain that senses that there's a danger has essentially instructed you, without you even thinking, to run away. And that is a normal response. You're not going to fight this guy. You're going to run away from him. Now, we can't do that, obviously, on the tennis court, and I can't do that in the emergency department as well. We have we have a commitment to the people that we're serving. But if you look at the faces of these two gentlemen, they don't look a lot different than the previous slide, right? They're angry. There's probably some loud noises coming out of their mouth, and they might be moving in your direction in what looks like an aggressive posture. And I'm sure all of you, at some point in your life, have encountered sort of this agitated, angry person. And so you have to think, I'm not going to run away. I'm the official here. I need to somehow handle this situation. And so, the first thing I would say is you want to try to share your calm, and that's much easier said than done. But if this is not something that comes naturally to you, then at a minimum, don't join the chaos. And this is sometimes what I see happen, especially with people that are in at least in my emergency department, that are working in my emergency department, that are new and haven't been exposed to chaotic situations. They tend to join the chaos, and the chaos escalates, and things get out of control very quickly. So if you can remember not to join it, even if you don't know how to handle it, you'll at least have prevented it from getting a lot worse. And the example I like to share is that on an airplane. So, if you've ever been flying and all of a sudden there was a little bit of turbulence, and the captain said, "Flight attendants, please take a seat," depending on what's coming, they might move rather slowly to their seats. They might finish, serving a couple more aisles, drinks and snacks, or sometimes they move rather expeditiously to their seats, and just quickly stow whatever equipment that they have. But what you've probably never seen is the flight attendant saying, that you've never seen them lose it. You've never seen them all of a sudden panic and say, "Oh, get ready, we're going to crash." Or, can you just imagine if they were throwing their hands up over their head and running down the aisle to get into a seat? Can you imagine what everybody on the plane would start doing? They would probably mimic that behavior. So, setting the example and sharing the calm really is a very effective technique. Now, what are you going to do when that angry parent or that angry coach or that angry player, starts to get agitated? Or maybe it isn't even agitation. Maybe it's just that they've recognized that there's a problem, and now there's a conflict, and they're coming to you and you have to solve it. I think the very first thing is to remember that everybody approaches issues with a slightly different perspective. And I can remember taking a seminar on a roving seminar, and we went down to the court for the practical portion and stood at the net, and the instructor put a couple of tennis balls on the far side of the court. Some were on the line, some were off the line. Really, and she went around and asked everybody, was it in, was it out? And there was disagreement. And this happens all the time. So I think if you just remember that even though you might be 100% sure that you're right, the other person might be 100% sure that they're right too. And that's not going to be sufficient for mitigating the circumstances. Last fall, I took my kids to an apple orchard. We like to do this every year. And there happened to be a corn maze at this one that we went to. And in this picture, my daughter's on the left, she's 6, and my son's on the right, and he's, I think, 4 in this picture. Maybe he's 3, almost 4. Anyway, my kids said, can we, go into the corn maze? I thought this would be great. Now, we're going to have a few minutes of downtime. We'll just send the kids off into the corn maze. Well, I could hear them talking. They were happy as they started walking down, but they got to the first fork in the road, and my daughter said, "Let's go this way." And my son said, "No, I want to go this way." And one of them said to the other one, "That's stupid. Let's not go that. I don't want to go your way. I want to go my way." So, when there's a disagreement and there's a negative emotion connected with that disagreement, that's when you have conflict. And wouldn't it be nice if we could just have disagreement without negative emotion? But that's just really not kind of the human response to a lot of problems. So think of conflict kind of on a spectrum of a spectrum that could either get worse or could kind of get better. So we're mostly going to talk about conflict today, but just to put this into perspective, when conflict escalates, and hopefully this is never the case on the tennis court, but it can become a crisis. We see this certainly in my specialty, and when that happens, we have to intervene in order to create safety. I don't really think. I mean, I've only been an official for I guess just coming up on a year. I haven't run into any of those scenarios. I hope none of you have ever run into a scenario like that, but I know you've run into conflict scenarios. And that's where de-escalation techniques are most helpful. But before there's conflict, there's what I like to call pre-conflict. And this is usually a pretty happy time. No one's disagreeing. There's no negative emotions. But this is a time where you can focus on prevention of conflict without even knowing that there's going to be a conflict. You can do some things here to hopefully prevent conflict or to make it easier to de-escalate conflict. And they're just very simple things. You're probably doing them already, but it's it's basically fostering relationships with the people that you're interacting with. So maybe it's talking to the coaches before the match. At least for me, it's always introducing myself, letting them know, I'm the official. But maybe if it's somebody I know a little bit better, maybe it's complimenting them on something relevant to the day, whatever the case may be. But you kind of get the idea. When you do these kinds of things, you're not only you're sort of creating credibility for yourself, but when conflict does come up, it becomes just so much easier to manage it. The problem is that even despite your best intentions, you can escalate problems without even knowing it. So if you're rushing someone or you're ignoring someone who's bringing up a problem that you don't think is important, that can escalate the problem. Appearing frustrated for whatever reason, maybe it's completely unrelated to the issue at hand. I'm getting a little feedback. I
Yeah.
hope that's not me. Okay.
No.
So anyway, if you're appearing frustrated, that may escalate the other person. In my work, I avoid using titles. I just use my first name so that doesn't sort of create any issues around power or kind of control, anything like that. And then not asking someone their name, but just immediately asking them their name before you've introduced yourself can also, I think, rile people up a little bit. And so, the example here is that if someone calls me on the phone and says, is Bob there? My first response is, who's calling? I want to know who that is first. And I think, whenever possible, we want to extend that same courtesy to other people. So conflict doesn't always go to crisis. Most of the time, conflict goes to resolution. And if the people that you're interacting with kind of have a calm baseline before conflict starts, you can expect they might get a little bit anxious. But usually, when when things are with time, at least, or possibly with some de-escalation techniques, things return to normal, and people that were calm initially and got a little anxious usually get calm again. But if you're working with people that are anxious at baseline, they're going to escalate. Their behavior is going to escalate beyond being just anxious. They're going to be upset, and they're more likely to get frantic. And it's much harder for them to return to their baseline of just being anxious, and they certainly aren't going to return to being calm during that resolution phase. So you kind of want to be aware of this. And ultimately, what you'd like to be able to do is use some techniques to control the trajectory of that red line. So that slope right now of that red line is pretty steep. But if you fail to, if you're unintentional about your actions, both verbal and nonverbal, you may escalate the situation even faster. And then the opposite is that, with de-escalation techniques, hopefully you can decrease the slope of that line and prevent those bigger emotions from coming forward. So that'll be kind of the goal. Some experts have said, what you do in that first 5 seconds when pre-conflict moves into conflict, that's the time that really matters the most. And not only is it the time that you can perform a lot of de-escalation, but it's also the time that you can perform a lot of escalation if you're not careful and thoughtful, again, about what you say and how you carry your body language. And so, again, my goal is going to be for us to kind of go back to that pre-conflict phase, if at all possible. And things that de-escalate situations are things that convey respect to the people that you're interacting with. Side note, if you haven't seen Aretha Franklin's cameo in Blues Brothers, highly recommend it. Fantastic movie. Really cool scene. But listening turns out to be a great way to convey respect to people that are angry and agitated. And you can do that simply by not interrupting them. And that sounds so simple and so easy, and is yet so hard to do. In my world, we teach the medical students, it takes an average of about 20 seconds before a doctor interrupts a patient when they first ask them, why are you here? What's wrong with you when they're in the emergency department? I mean, doctors can't even keep their mouths shut for not even 1 minute before they interrupt somebody. So anyway, if you can avoid interrupting them, and listen to them and let them get out whatever the problem is, a very effective technique for conveying respect. And simple ways to do that is after they're done, is to say to them, what I heard you say is, and put in whatever they were complaining about. Or let me see if I understand you. You're upset because I made the wrong call, or whatever the situation is. And when you repeat back to them what they just told you, again, they now understand, whether it's conscious or unconscious, that you understood them. Huge for de-escalating the situation. It only takes seconds to do that. Listening does take a little bit longer, and if someone's on a rant, that can be difficult to just stand there and listen and take it all in. And I found that takes a little bit of practice to be able to do that effectively, but I think is very important. So for the first 5 seconds, what you want to do is you try to slow down. It's going to seem like things are going very fast. And, if it's an on-court situation, or if you're off-court and you have a million other things you want to get to, it's sort of normal to try to want to rush the situation. I want to take care of this so I can get on to the next thing, but that's a mistake. You're going to need to take some time here if there's a conflict. And so slow down and give that person the time to communicate what they're upset about. While that's happening, turn your body about 15 degrees off center, so that the position of your body is not a threatening one. So if you're squared off directly against the other person, that often feels confrontational to the person that you're standing in front of. Whereas if you turn that 15, 20, 30 degrees, something like that, it's a much more relaxed position. The person speaking, they can see past you a little bit. Their words can kind of go around you. It just doesn't feel like you're being closed off or you're being confronted in any way. The next thing to do is just to give them your full attention. So you're going to listen, you're going to make eye contact, and I'll talk more about eye contact in a slide or two ahead. You do want to, during that time while they're talking, you do want to acknowledge that they're what they're saying, whether that's a head nod or an aha or something along those lines. Here we go. If this may not be appropriate on court, but like in the case that Lisa described initially, introducing yourself, shaking hands, and finding out their name is a nice way to get started. When you do start speaking, and if it's possible. And again, if the problem's on court, it's not going to necessarily be possible, but you'd like to ideally get somewhere that's a little less public, moving into an office or moving slightly away from the stands, whatever the case may be, because those other people that are around that are listening, they're just going to kind of make make matters worse for you. And it's going to be a lot harder for the other person to follow through with your recommendations if there's others that are there and listening. So that's another, when you can do it, is another nice technique. I do think nonverbal communication is really the key. And I mean, words matter too, but people are really picking up on your body language and expressions on your face. And the nonverbals are gonna tell them all kinds of things about what you're thinking, or maybe what you're planning to do. So they do transmit your emotions, your biases, prejudice. Power may or may not be really a relevant thing here when you're the tennis official. I mean, clearly you're in charge of the rules, but um, your nonverbal style can also set expectations for what's going to happen or what should be happening next. And I love this expression that people rise or fall to the expectations that are set for them. I find that's frequently the case as well. And then I was just attending a panel discussion the other day with a group of patients, and it was a completely different topic, but they were basically saying that when it comes to communication, nonverbal communication is so much more believable than verbal communication. So, if my wife and I are having a discussion about something, and she says, "It's fine," and she kind of says it like that, and then she'll turn away and walk away, I know it's not fine. Like, in fact, I've got a huge problem on my hands, and how I'm going to address it is depends on the situation. But her body language is clearly communicating to me that everything is not fine. In fact, there's a big problem. So um, I think it really is a significant portion of what happens when things start to escalate is because of nonverbal communication. So I mentioned the 15-degree stance. I mentioned the handshake. Again, when it's appropriate, it may not always be appropriate for tennis officials. A smile. When you can put a smile on in a difficult situation, it's a great diffuser. And then we talked about eye contact briefly before, but here's the 70-30 rule, which is when you're listening to someone and they're on a tirade, if you just stare at them and you don't blink, it can be really weird, right? Like some of you have probably experienced someone staring at you, and it's very uncomfortable. So, my recommendation would be to spend about 70% of the time looking at someone so they know you're paying attention, but look away for a few seconds. Look at the floor. Try not to look around them, because then they'll think that you're distracted by something else. But looking down at the floor for just a few seconds and then looking up and making eye contact is probably the most comfortable way to acknowledge what they're saying. What do you do with your hands? Your hands should probably be in some type of a neutral position, because as I'll show you on the next slide, the hands can convey a lot of things if they're in the wrong position. But the general recommendation is to keep your hands kind of low, probably below your waist, or you could put them behind your back. In my world, we don't teach people to put hands behind their back when they're de-escalating, because there's sometimes safety issues, but that shouldn't be an issue hopefully on the tennis court at all. And so I think you could very comfortably put them behind your back, or pockets would be okay too. But things not to do with your hands. You don't want to touch the person. That's for sure. That's can be a very threatening or off-putting thing to do. You don't want to point at a person. I don't think any of you would make fists unless it was completely unconscious, but probably people that are close to you can let you know what you do with your hands when you're in difficult situations. Try to avoid putting your hands on your hips. That's more of like I'm a judging you type of a position. And similarly, when you cross your arms, that's also sending this message of like, I'm frustrated, or I'm done with this. I'm ready to make a decision and move on. I'm no longer listening to you anymore. And then if you don't know what to do with your hands, if you're one of these people that's like, it's awkward for me to keep my hands at my waist, I talk with my hands, my hands are constantly moving, then a couple things you could do, a couple suggestions is, one is to do this, try to get them on the screen here, is this praying ninja pose is what it's called, where you kind of put your hands together. And, that's kind of a peaceful kind of a peaceful position. I guess we call it the praying ninja in case you do need to defend yourself. But again, it doesn't really come up so much in emergence in tennis. The if you're sitting down and you're having a conversation, this kind of a contemplative pose where you put your hand on your chin is also pretty neutral. And then some people just, if you can't keep your hands at your waist, if you put them on your heart, it's kind of looks more, it's called the empathy pose, but that's at least the research would suggest that that's pretty non-threatening as well. But you want to try to be neutral with your hands, and because your hands can definitely get you into trouble if you're not aware of where they are. Um, some basic verbal tools, which again, you're going to know what to say. Like you're going to know what the situation is, again, on or off the court related to the match or whatever. I don't have to kind of go through those details. The rules, you know how to enforce the rules, etc. But when it's possible to ask someone to do something rather than to tell them to do it, that's usually received in a much better way and is much more likely to prevent escalation from occurring. And when it's possible, if you can give somebody some options, all of which should be acceptable to you, by the way, then that gives that person a little bit of power as well, or at least it gives them the sense that they have a little bit of control over the situation, again, as opposed to, I need you to, fill in the blank. When you can find something that that somebody's done something they've done it well, and if you're able to praise that behavior or thank them for that behavior, again, a really effective way at conveying respect, and again, leading towards more de-escalation. And then I sort of debated about whether to talk about this or not. And I don't know how all of you will feel about blaming the rules. You know, blaming the rules can be helpful because it takes the blame off of you. You're not the bad guy. You're just enforcing the rules. And, that is the job of a tennis official, is to know the rules and to enforce the rules. But whenever it's possible and it feels like it's an appropriate thing to do, it could be helpful for de-escalation as well. Now, this is one that I use all the time, because when people are mad and angry and there's conflict, they tend to raise their voice. I know I do. And the method that's very effective, shown over and over again in all the research studies, is to go about 25% below the volume you wish to achieve for the conversation. So if they're speaking at a 4 out of 10, you go down to a 3 out of 10. If they're in an 8 out of 10, you go down to a 5 or 6 out of 10. And then once you get them to that level, then you can take them down another 25%. And as the conversation goes on, it'll move from a yelling match down to a normal speaking tone. Enunciation is also very important. So I hope no one ever says this on the tennis court, but just as the example, there's six different ways to say, did you say I was stupid? So I didn't say you were stupid. Well, if I put this emphasis on that, I'm basically saying that somebody else did. I didn't say you were stupid is probably really what I meant to say, right? I didn't say you were stupid, but I probably thought it. I didn't say you were stupid. Maybe I thought somebody else was stupid. I didn't say you were stupid. I actually think you are stupid. Or I didn't say you were stupid. I said something else that was awful, right? So you can think about that a little bit, about your responses to your answers to questions that come up or to accusations that come forward, and what do you emphasize, and how is that being communicated to the other person? Now, it can be effective to maybe model sadness. Now, I was thinking a little bit more about this for tennis. I don't really think I want to go quite that far, but there are very definitely, there are facial expressions that convey sadness, and depending on your tone of voice, right, it could be happy, it could be sad, it could be neutral. I think neutrality might be the way to go here for us. so that when you do have to enforce a rule, your nonverbal communication is such that you have a neutral tone. Um, uh, and certainly what you want to avoid is being happy about it, right? So if you're gonna code somebody, you don't want them to think that you're happy that you just did that. And I doubt that's an issue for anybody, who's been doing this. But again, it's really just kind of being aware of your nonverbal communication. So there are escalators and there are de-escalators. And not to bore you with neuroanatomy, but the escalators are the things that engage the part of your brain called the amygdala, which basically controls this fight or flight response that we talked about before. And things that engage the amygdala are threats and disrespect. So you want to avoid those at all costs. And the opposite side are the de-escalators, and they're the ones that engage the prefrontal cortex of your brain. And that's like your executive function. And if there's if there's anybody here who's a neuroscientist, I apologize. I'm greatly simplifying this, but hopefully you get the point. If you engage the prefrontal cortex, then now we're into memory, we're into self-regulation, we're into mental flexibility, and boy, that's really what we want when there's conflict. Is we'd like to find some sort of resolution that often requires both parties to be flexible in finding a good solution. And anyway, when you do that, you're or things that engage the prefrontal cortex again are safety and respect. So probably the last thing I'd ask you to think about is what sort of really gets you ticked off, because if you're going to remain calm, you need to be aware of what's going to get you going. And so, I'm not going to read all these, but I wrote down a whole bunch of them that might get me upset depending on the situation. And, some maybe specific ones for the court. Some or maybe all of these might be some of your triggers. Oh, sorry. So think about it a little bit. If you can identify your triggers before you get into a conflict, then when all of a sudden one comes up, you're ready for it, and it doesn't catch you off guard. You're kind of getting into trouble. When you're going to start escalating the situation, or certainly when you're no longer able to de-escalate the situation. When you start doing some of these things here, stop listening, talking over the other person, you're now talking as loud or louder than they are, etc. And even if you're not doing any of those behaviors, if you notice that your heart rate's getting up, you're breathing faster, maybe you're holding your breath, or now you're not even making calls as well as you were before, then it's having an effect on your physiology as well. And this is going to make it much tougher for you to control the situation. So your emotional distress is going to increase depending on the nature of the conflict. If you've if you've had a problem with that person before, or if any of those triggers come up, it's going to get you to some degree. And if you've come to that match and you're already stressed out with stuff that's totally external to tennis, or you forgot to have breakfast or lunch, or you have a cold, that's also going to make it a little bit harder for you to deal with these stressful situations. So some of these you can control, some of them you can't. But again, having that awareness will equip you better to manage the situation. And I like to kind of think of it, and I'm kind of a graphic learner, but when your emotional distress is low, your ability to think clearly is very high. You have very good cognitive capability. But as that emotional distress increases, you're going to develop those behavioral changes. And really, if things get really tough and your emotional distress is high, you're not going to be able to perform. I would say you need to find a replacement at that point, or take a break or something like that. But you want to avoid that situation. If you pick up on the fact that you're having behavioral changes, dial it back. Maybe take a little break and get back into that cognitive space so that you can think clearly and move forward. So kind of to summarize, some conflicts you can prevent, and to the extent that you can build those relationships ahead of time, it will hopefully prevent you moving from pre-conflict into conflict. But when you do recognize that conflict's occurring, you do want to address it right up front. No need to run away from it. It's better to get on it in the first 5 seconds, in some manner that conveys respect to the person that you're interacting with. And like I said, take your time. Don't rush these situations. The training in like the Navy SEALs, the Special Operations group, they always talk about slow is smooth, smooth is fast. And so you've got to take your time and address these things. Try out some of these strategies. If you're not doing them, or if any of them are new, give them a try. They don't always work all the time, but sort of the more you have in your tool belt, the more effective and helpful it can be. And then just remember your own triggers, and remind yourself of them before you get started, so that they don't catch you off guard, and then you can react to them kind of in that calm manner. So I'm going to stop there. And Lisa, if there's time, I haven't been looking at the chat, but if there's time, I'd be happy to take any questions.
If anybody has any questions for Dr. Hyde, please feel free to unmute yourself, or you can put them in the chat and I can ask. There's so many things I think that he brought up in this presentation to all of us that are applicable on the court. When we had this initial conversation about a month and a half ago, he told me a couple of the things that just are resonating in my mind, and I've been using them as I've been on court with all these USTA kids and all these parents, and I can't wait to try them when I'm out there doing some college work here after the first of the year. But I never ever thought about the 15 degrees, like trying to stand and position myself 15 degrees off center to that person. If you think about boxers, and when they're getting ready to fight, they're always face to face, and you never see them at an off angle when they're getting ready to fight. So I thought that was really interesting. And then I also have been using the talking softer than the person talking to me. I'm a really loud talker. I think everybody knows that, but that's a really hard thing for me to do because of my natural voice. So I really have to think about that when I'm on the court and people are asking me questions, or it does escalate into a situation that could become spicy. I have been trying to take a step back and lower my voice. And so I'm working on that one, Bob. I'm trying really hard. We'll see how that goes. But does anybody have any questions for Dr. Hyde? Okay, so I see a comment in here, positioning is hard to do in a chair, and I agree with that in some ways, but instead of thinking of it moving side to side, up and down is another way to think about positioning as well. Oftentimes when I have a coach that comes in conflict with me, I lean in, so it looks like that I'm engaged and I'm listening to what they're saying. I know other people kind of lean back to give more space between the two. So it's how you're comfortable. But that might be a way to think about that. Another comment, it's difficult to take a break when you're in the chair and you don't have much time to engage with the coach when you are in the chair. I agree with you on that. It's difficult to take a break, but even on those changeovers, that 1 minute where you can take a couple of deep breaths and you can collect yourself and think about, okay, we're going to focus on that next point. We're going to put everything in the past. We're going to focus on that next point and keep moving forward. I think that will help. Also on the set breaks, you know, you get 2 minutes there while if you need to get out of the chair and walk to the side of the court, to the far edge of the court, just to, you know, take a breath and kind of calm yourself down a little bit, that's helpful as well. And then, yes, what you're saying about you don't have much time to engage when you're in the chair, that's correct. So, but it's still important to take, maybe you don't have 5 minutes. So maybe when you're in a chair, maybe it's, you know, 15 seconds. But the key when you're sitting in a chair or in any on-court situation is make sure that you're being a good listener and you let them talk first, because most of the time people just want to be heard when they have a disagreement. And so you want to make sure that you're listening and you understand the position and where they're coming from. So then you can come back with your best response in a short and tight fashion. And Karen, yes, we should come to your jail and protect your de-escalation techniques. Very funny. Does anybody else have any questions for Dr. Hyde? Dr. Hyde, please follow up on anything I just talked about. I was kind of bringing that specifically to the tennis court, so I don't know if there are some other suggestions you might have.
No, I think that's great. I can't really comment on the chair position. I have not done any of that work. Maybe someday, but
We'll get you there. And be careful what you wish for sometimes. um, Michael X said, great point. He said, remember also, if you're in a chair and you're on the court and you're wearing sunglasses, to remove your sunglasses when you have that conversation with the coach or player. Because those sunglasses work as a barrier. So it's really important, if you can, to take those off while you're engaged in conversation. All right, well, if there are no more questions, I want to thank Dr. Hyde for joining us tonight. And we now are going to kind of flip into part 2. Oh, wait, I have one more thing I wanted to add about that. Someone did ask me, and I think I mentioned this before, this presentation, I have asked the USTA to consider this as part of our continuing education credits. They have not gotten back to me yet, but I will send them the video and I will follow up with them. So hopefully all of you that are attending could qualify for continuing education credits for the 2024 year. So